Hello, this is a virtual pathology specimen taken from our virtual pathology museum, and here is an example of a choriocarcinoma involving the testis. We can see a very enlarged testis here, and also metastatic choriocarcinoma in the liver. Let's take a look at the annotations. So for an overview, we can see that this is a slice of the liver with the pale tan uninvolved liver parenchyma and these well-defined dark brown nodules of metastatic tumor in the liver. And the testis itself is very enlarged and it is replaced by this tumor mass with these blackish areas of hemorrhage. We also have an adjacent adherent bowel loop here, and in the patient, this has caused a hernia. Let's have a closer look at the testis. Here we can see that there is a fleshy, pale tan tumor with many blackish areas of hemorrhage. And not only that, if we look at higher magnification, we can also see these geographic pale areas of necrosis as well. So there is a combination of blackish hemorrhage as well as pale necrosis. And in the liver, there are multiple, very well defined, dark brown metastatic tumor deposits. The reason for this tumor to be so hemorrhagic is because it is composed of trophoblastic tissue, and trophoblastic tissue tends to burrow into blood vessels in order to obtain blood supply from the maternal blood vessels. So let's just turn this specimen around, and again we can see similar features of these very well-defined metastatic tumor deposits in the liver. And this tumor in the testis has not broken through the coverings of the testis. Choriocarcinoma very often gives rise to distant metastases. Another tumor that can have this very dark brownish color is malignant melanoma, and melanomas usually appear dark brown, sometimes even blackish, due to melanin pigment that is actually produced by the malignant cells. And this is quite a different reason from what is seen in choriocarcinoma, because this is due to hemorrhage and hence extravasated blood. Let's learn a bit more about choriocarcinoma. Choriocarcinoma is a malignant germ cell tumor, and this arises from trophoblastic tissue. It usually occurs more frequently in females in placental tissue, and hence it involves the uterus. However, it can rarely occur in the testis, mostly as part of a mixed germ cell tumor. So there will be other germ cell tumor elements, for example, seminoma, but less commonly it can occur in pure form in the testis. This usually is associated with raised serum beta-HCG levels. There is a painless scrotal mass, and the patients may actually present with metastatic disease because, as mentioned, this choriocarcinoma has a propensity to invade into blood vessels, and hence distant metastases are common. So patients may present with hemoptysis, for example, with lung mets, or even seizures in the case of mets in the brain. Metastases can also occur in the liver, as you see here, and in other organs. There is generally a worse prognosis in the testes compared to choriocarcinomas arising in placental tissue. These tumors that arise in placental tissue in female patients tend to respond very well to chemotherapy. So grossly, we can see a tan tumor with very marked hemorrhage, and hence these tumors often have a blackish cut surface grossly or appear dark brown. There may be areas of necrosis, as we have seen, and even in the metastases we have very hemorrhagic tumor deposits. Here is an example of a fresher tumor where we can see the fleshy tumor parenchyma as well as many dark blackish areas of hemorrhage. And here is an example of a choriocarcinoma in the uterus. This is the area of the tumor with blackish hemorrhage as well as pale necrotic tissue. And this is taken also from our virtual pathology museum. Microscopically, the choriocarcinoma in the testis will appear similar to that in the uterus. And we are just focusing on the choriocarcinoma component here. We can see multinucleated syncytial trophoblast and also cytotrophoblast, which are mononuclear cells, and lots of mitotic figures and hemorrhage. So the trophoblastic tissue will be composed of cytotrophoblast, multinucleated syncytial trophoblast, and also intermediate trophoblast. Often we see vascular invasion and hence hemorrhage and sometimes necrosis. And again, you can explore our virtual pathology museum. This is free of charge and you can access it via our online pathology resource, Pathweb. You may scan here to see more, and also the link for registration is in the video description and it is completely free of charge. This is a snapshot of the female genital tract chapter where you can see many other conditions, including choriocarcinoma. Hence, in summary, here is an example of choriocarcinoma of the testis, which is a tumor with many areas of darkish hemorrhage and some pale necrosis, with metastatic choriocarcinoma involving the liver, where we can see multiple well-defined, rounded, dark brownish tumor deposits. Thank you.